This is a 12.5-pound bowling ball, and the average skull is 9 to 15 pounds. And so this is a fairly average skull. And so imagine that bowling ball sitting right in that tiny little cup of that atlas bone. So the atlas itself weighs about 2 ounces, and the bowling ball that sits on top of it is between 9 and 15 pounds. So where this bone sits right at the base of the skull is very susceptible to injury. So if you were in a car accident where you had your neck whipped or whatever, or rear-ended where you had the weight of that bowling ball pulls that atlas crooked, it will actually change the way that the bone is aligned in there. So my specialty is correcting the alignment of that vertebra. We see patients with that bone displaced with various different injuries. Everything from a difficult birth trauma to young boys playing football. We're seeing a lot more cheerleading accidents where they fall or they're not being caught correctly, all the way from motorcycle accidents, obviously car accidents where it gets, the top of the skull gets whipped, and it changes that relationship. A lot of times the symptoms won't come for several weeks, even months. So what we see a lot of times is after somebody's sustained an injury, they may be sore a little bit, but then the symptoms don't go away. The headaches stay in there. They become more frequent, more severe. The neck pain comes in here. The blood supply to the brain, partial blood supply to the brain, comes up through each one of the holes in the neck bones, up, and it does 4 90-degree bends, hooks around a little curve right there, and then goes up into the brain. So we know that when the bone is crooked, out of place like this, not only does it affect the brainstem down, which will give us problems with headaches and neck issues and pain all the way down the spine, even into the low back and in the leg, but it also shuts off blood supply to the brain. That part of the brain, right up in the very top, that bone, when it's crooked, shuts off blood to the brain, as we talked about, and is the major cause of dizziness. About 96% of all dizziness, nausea, lightheadedness, even energy loss, more pain, eye movement, emotional stuff, brain fog. One of our big complaints with patients is brain fog when this bone is crooked for a long time. It affects neurological control of the heart, the lungs. There's one new research article about high blood pressure being affected by this bone being crooked. As an atlas orthogonal chiropractor who uses a specific method to correct this atlas, I get asked often, how does the instrument work? Because most patients don't even feel the instrument. So the easiest way to explain it is we measure this bone from the side, from the top, and from the front. So we call that the X, the Y, and the Z measurements. So if it is tilted, twisted, and bent, we can figure out the mathematical formula to move that bone back in the right position. And we use an instrument to do this. So this instrument allows us to change the X up and down to where we can correct that. We're able to move and change the Y-axis degrees this way, and we're able to move the Z-axis degrees this way. So every kink that is in the neck, we can figure out a mathematical formula to unwind it. Then when we put the patient down on a pillow, we bring the instrument into the atlas, and when the instrument is in the proper place, we step on the button, and there's a very light force that actually moves that vertebra.
Just most recently, I've lost a leg to a dirt bike accident and suffering from severe phantom pains, and came to see him just because I knew my neck was out.
The phantom pain, by just adjusting the bone up on top, completely resolved his pain that he had going down into his leg.
When I was just shy of my 21st birthday, I started experiencing numbness on the left side of my body. Ended up being diagnosed with multiple sclerosis. Within days, sometimes weeks, it just depends on the episode, my symptoms dissipate and I live mostly symptom-free, and I have to this point refused traditional treatment for MS.
I fell and injured my neck. I went to the hospital with it, and they took some CAT scans, and virtually all they did was give me pain pills. And I finally went to my doctor, and he actually recommended Dr. Harding. Actually, the first treatment I felt relief.
If we're able to correct that and change that, imagine what we could do in your neck if we correct your atlas with our specific correction and no popping and cracking in the neck.
I'm really happy that we found this place because without it, I would not be able to do the things that I do today.